You wake up in the middle of the night. There is a throbbing, blinding pain shooting from your jaw straight to your brain. You have a toothache. If it were today, you would immediately swallow a painkiller and book an appointment for the next morning with your dentist, who has a modern, spotless clinic. But wait, the year is not today. The year is 1348. Moreover, there is the Black Death Plague ravaging Europe outside, and this is not your only problem. There's no clinic around, no local anesthesia, and no sterilized instruments. Just you, an infected tooth, and a blacksmith whose actual profession is horseshoeing, waiting with a rusty pair of pliers in his hand to relieve your pain. Today, we will examine how an ordinary toothache in the Middle Ages turned into a real life-or-death struggle, from the legendary toothworms believed to eat the tooth from the inside out, to the blood-curdling instruments of barber surgeons, and the bizarre methods where dead mice were used to soothe the pain. We are delving into the corridors of the past. If you're ready, sit back. Part 1. The monster in your jaw, the toothworm myth. In medieval Europe, if you had a toothache, no one could tell you that the cause was microscopic bacteria, sugar consumption, or enamel decay. They had a much more concrete, much more terrifying explanation: the toothworm. Yes, you heard that right. For thousands of years, starting from the Sumerians until the late Middle Ages in Europe, people believed that a toothache was literally caused by a little worm that had nested inside the tooth, digging tunnels by gnawing away at it. When they looked at cavities, they thought those black holes were the worm's nest. The throbbing of the pain was interpreted as the worm moving and feeding inside. So how would they get this worm out? Modern medicine would say root canal treatment. Medieval medicine said fumigation. If you had a toothache, the village healer would administer a treatment. They would take some henbane seeds and beeswax and throw them onto glowing coals. You would be asked to put a funnel-shaped tube in your mouth and inhale the thick, toxic smoke produced by these burning seeds directly into your aching tooth. Henbane is a poisonous plant with hallucinogenic and mild narcotic effects. When you inhaled this thick smoke, your brain would go numb and your pain would temporarily ease. But the actual tragic-comic event was this: the henbane seeds burning on the coal would burst from the heat and scatter into the ashes, taking shapes that looked like small, curled-up dead worms. Due to the medical knowledge of the time, the healer themselves believed this and would proudly show you the ashes, saying, "Behold, we have drawn out the worm causing you pain with the smoke. Look, here it lies." Your pain was alleviated by the narcotic effect of the henbane, and you had seen the worm come out with your own eyes. The treatment was considered successful. That is, until the narcotic effect wore off a few hours later, and that excruciating agony returned. Part 2. Butchers, blacksmiths, and barber surgeons. Let's say fumigation didn't work. The pain is now unbearable. Your face is swollen and the infection has reached your jawbone. There's no choice but to extract the tooth. So who will you go to? There's no faculty of dentistry around. Your options were the village blacksmith, the butcher, or the slightly better barber surgeon. In the Middle Ages, barbers didn't just cut hair and trim beards. They also let blood, applied leeches, amputated limbs, and extracted teeth. Let me even give you this piece of information. You know those famous red, white, and blue spinning poles at the doors of barbershops today? Well, those colors have a blood-curdling history. Red represented blood, white represented bandages, and blue represented veins. When you stepped into the barbershop, you would realize that the concept of hygiene did not exist. Instruments were generally unwashed. The blood, pus, and saliva of the previous patient would be waiting for you dried on the rusty metal. To extract your tooth, the barber wouldn't use those delicate, fine-tipped instruments of today. Their favorite invention was a terrifying mechanism called the Dental Pelican, which looked more like an instrument of torture. The pelican got its name from the beak of a pelican bird. The barber would place one end of the tool on your healthy tooth next to your aching one for leverage and hook the other claw-shaped end onto the tooth to be extracted. Then, using almost all of his arm strength, he would twist the tool sideways. This tool did not pull the tooth vertically upward, it ripped it out by prying it sideways. One of the first things you would hear during this procedure would be the horrific cracking sound your tooth made as it was ripped from its root. However, the pelican was such a crude and uncontrolled tool that it was extremely common for it to tear away a large portion of your gums or even a piece of your jawbone along with the tooth. Sometimes the adjacent healthy teeth would accidentally pop out of place. Part 3. Coping or not coping with the pain. During all this flesh-tearing, bone-breaking, and tooth extraction, was there local anesthesia? Of course not. While the barber surgeon was doing his job, probably two burly apprentices were pressing you down firmly on a wooden chair and holding your arms. You felt the pain literally to your marrow. If you had a little money and knew you couldn't withstand the pain, you could buy a type of anesthetic potion called Dwale. However, this potion could be even more dangerous than the tooth extraction itself. Dwale was made by mixing substances like boar bile, opium, mandrake root, hemlock, and vinegar. Mandrake and hemlock are extremely potent and deadly poisons. When you drank this mixture, you would fall into a deep coma-like sleep. You wouldn't feel a thing while the barber pulled your tooth. Everything sounds great so far, right? The problem was this: the science of dosage adjustment had not been invented. If the healer dropped a few extra drops of hemlock into the mixture, you would never wake up from that deep sleep. You were cured of your toothache, yes, but you had also lost your life. Because of this, rather than drinking poisonous potions, many people preferred to drink plenty of cheap wine or beer before the extraction and rely on the numbing effect brought by drunkenness. Part 5. The peak of desperation and bizarre folk remedies. If you didn't have the money to go to the blacksmith, or if you felt like fainting from fear when you saw the pelican tool, your last resort was word-of-mouth information and bizarre folk remedies. We can say that one of the greatest proofs of how humanity can push the boundaries of logic when desperate emerged during this period. If you had a toothache in the Middle Ages, some of the treatment methods you could apply were dead mouse paste. According to a belief stretching from ancient Egypt to Europe, since mice had strong teeth, they were good for dental diseases. People would crush a dead mouse into a paste and apply it directly onto the inflamed, open gum. It is not hard to guess the deadly infections they contracted as a result. Kissing a frog. Catching a frog on a full moon night and spitting in its face or kissing it directly on the mouth was often done with the belief that it would transfer the toothache to the frog. Finding a donkey. According to a weird English folk belief, if your tooth was aching, finding a donkey and kissing its nose would immediately relieve your pain. Praying to Saint Apollonia. Apollonia, the patron saint of dentistry, was tortured for her faith during the Roman period, and all her teeth were violently pulled out before she was burned. People carried amulets made in her name around their necks and prayed to her to soothe the pain. Part 5. The Black Tooth Fashion. Although the poor and peasants lived in terrible conditions in the Middle Ages, ironically, their teeth were much healthier than those of the nobles. This was because the peasants' diet generally consisted of hard whole wheat breads and vegetables. However, during the centuries when the Middle Ages ended and the Renaissance period began, a brand new, deadly luxury arrived in Europe with the expansion of trade routes. They discovered sugar. Sugar was an incredibly expensive and rare spice brought from the East. Only the wealthiest, the nobles, and the royal family could access sugar. This situation gave birth to one of the weirdest status symbols in history. The rich were adding handfuls of sugar to their meals, their wines, and even their meats. Because they constantly consumed sugar, their teeth rapidly decayed, turned pitch black, and their mouths smelled unbearably. It is clearly stated in historical sources that Queen Elizabeth I of England, particularly in the late 16th century, had pitch-black teeth due to her extreme addiction to sugar, and people had difficulty understanding her when she spoke. But the crazy part was this: black and rotten teeth had become the absolute status symbol of wealth. It was a tragic way of saying, "I'm so rich that I can eat sugar every day." This fashion spread so much that some middle-class people with healthy teeth intentionally began to dye their sound teeth black using coal dust or soot to appear more wealthy and nobler. Part 6. The nightmare begins after the extraction. You endured all those horrific procedures. The barber surgeon ripped your tooth out with his Pelican, your jaw didn't break, you didn't die from blood loss, and you returned home. Are you saved? Unfortunately, no. In the Middle Ages and the following centuries, infections were among the leading causes of death. The discovery of antibiotics was still hundreds of years away. An open wound, rusty instruments, and a surgeon who didn't wash his hands meant a perfect feast for bacteria. In the days following the extraction, your gums would inflame and your jaw would swell up like a drum. As the infection slowly mixed into the blood, sepsis or blood poisoning would begin. A high fever, shivering, loss of consciousness, and ultimately a painful death was a very common end to a process that started with just a simple toothache. So, in the past, a toothache wasn't just an annoying situation, it could literally be a death warrant. This dark picture of the past we've described actually reminds us once again of how valuable the things we have are. That slight nervousness you feel when you sit in the dentist chair today is a very luxurious experience by the standards of centuries ago. The tiny pinch of the anesthesia needle is a very small price we pay against henbane smoke, pliers, jaw-breaking pelicans, and dying from infection. If you don't have a toothache while watching this video right now, or if you've recently been to the dentist without any problems, stop and be thankful. And don't forget to brush those teeth before going to bed at night. After all, no one wants to fight imaginary toothworms hiding in their jaw. If you enjoyed this informative and gripping journey through history, don't forget to like the video, share your thoughts in the comments, and subscribe for new content. Let us know in the comments what you think the next video should be about. Goodbye.